We live in an isolating world of compulsive social media behavior and 24/7 access to sexual arousal. Is hypersexuality the new normal? Is sex addiction a real thing? Researchers are saying it may be, and that it might be more common than anyone thought. While opinions vary on definitions, and more research is needed, there is general agreement among practitioners that compulsive sexual behavior is deep-rooted and follows a pattern similar to those of alcohol, cigarette, or drug addiction. At the same time, sex addiction is different from other addictions, in that sex addicts use the most intimate act, the place where pair bonding can begin, to isolate themselves from intimacy. Sex addiction does not discriminate. It strikes men, women, gay, straight, young, old, religious, and non-religious alike. Though it's not any one particular act, preference, or even frequency of behavior that characterizes sex addiction. Sex addiction is about the relationship we form with sex that results in a destructive pattern of behavior to ourselves and others. To understand it, let's step back and see how sex addiction begins, how compulsive behavior takes over, and how therapy can help us regain control of our lives. People who suffer from compulsive sexual behavior often report having experienced traumatic events or deep unmet needs growing up. Whether it's a big trauma or lots of inconspicuous little traumas, if we don't feel safe within our family system, we protect ourselves by bonding with other things, like TV, food, alcohol, cigarettes, and sex. These behaviors release dopamine and other chemicals in the brain. This makes us feel good and safe. It's not uncommon to turn to certain medicative behaviors during stressful times, but for some of us, wires get crossed. We become emotionally stuck in a cycle of stress and reward. Sex addiction is likely rooted in childhood as an innocent coping behavior that turns into destructive patterns and faulty thinking as we get older. We rationalize our compulsive behavior with excuses. We form negative beliefs about others and ourselves. At first it works. Our excuses are convincing. At one point we might even wonder if we are addicted to sex. But the pattern continues. The string of breakups, the password-protected double life, the 1 foot in, 1 foot out relationships, the excitement, and deep frustration. We engage in riskier behavior, needing more to get the same result, the telltale spiral of addiction, until finally, crisis. Our partner leaves us, we get fired. Close friends fade away, we hit rock bottom. Do we stay where we are? Do we change? In a rare moment of self-awareness, we ask for help, a monumental first step. Therapy challenges faulty thinking. It gives us the conceptual tools to break from the stories and rationalizations that block true intimacy. We get at the underlying hurt and confront ourselves and the childhood defenses we've carried into our adult lives. We work through the guilt and the grief of loss, what was done to us, and what we have done to others. With courage and support, we open doors that once frightened us. In couple and group therapy, we retrain destructive habits of thought. Through this process, we gain relationship-building skills. How to talk differently, how to listen, how to accept and love ourselves and treat others the way we want to be treated. Recovery doesn't happen overnight, but we can change. With each step, we evolve, and we reconnect with our partner and family at healthier new levels. Some therapists say hope comes the moment we pick up the phone for help. Others see it in group therapy, when we offer advice to someone struggling with addiction. In that moment of empathy and connection, we are changing. There is hope.
It's hard to tell heaven from hell either way. Light glows in the dark. I get to thinking, then I come to my senses.